Hi, I'm Dr. Angie Nielsen and I'm going to be talking about the atraumatic restorative treatment. This approach is used to be able to arrest and prevent the progression of caries in both primary and permanent teeth in single surfaces, and it enables us to decrease the inequalities of oral health care. Some pre-reading for you, so you can get an idea of the evidence base behind the procedure and also the clinical steps involved. Your first step would be to prepare everything. So you get everything ready on the tray as you would use it in sequence. So we have on the tray the cotton rolls for isolation, some cotton pellets in different sizes, your mirror, your probe, your tweezers, an enamel hatchet, an excavator, ideally if you have a big one and a small one, not just one size, and a flat plastic or a carver for finishing. And there you have a conditioning agent. Here we have 20% polyacrylic acid, some water in another Dappens dish, and your glass ionomer. And on the top right you can see some Vaseline for finishing and as part of the press finger technique. There are 2 micro brushes there as well if you have them available instead of the cotton pellets. So here we have occlusal caries on a simulation tooth. There's a small access cavity, and our first step is to prepare. So the photo previously had all the instruments set up in order. The first thing we're going to pick up in the second step is for the isolation of the tooth. So you're going to use your cotton rolls. Anytime that the rolls are saturated with saliva, you just remove them and replace them. But for the purpose of this video, we'll place them aside, but they're there for you to use. So the next step is to examine the tooth. You pick up your mirror and your probe and gently probe around the fissures, gauge how deep that cavity is and see if there's any translucencies. And the next step is to access. So you're picking up your enamel hatchet, which has 2 blades on either side, and you're rotating it against that undermined enamel to chip off any enamel that's undermined. You're chipping off into the direction of the enamel prisms, so you're trying to retain as much tooth structure as possible. So you're being as conservative as possible in line with minimal intervention dentistry. The next step is to pick up your excavator. It's ideal to have a small one as well as a large one. And you'll be scooping out your decay, moving around the enamel dental junction first before you go down pulpily. So you're trying to keep away from that nerve area. Remember, you can leave soft dentine in there. You have to remove all the decomposed dentine, but you can leave demineralized dentine. So that the harder stained dentine at the bottom is fine, but the more soft bacteria laden dentine you need to scoop out. But if you feel like it's close to the nerve, then just leave that softer layer over the pulp. So we're trying to hold on to the pulp and being conservative as possible. The next step is to clean the tooth. So assuming we don't have running water, we can use the cotton pellets and dip them into lukewarm water, because remember, it might be sensitive if it's cold. And then we're using a conditioning agent. In this case, this is the 20% polyacrylic acid. If you don't have this and you're using a hand mix, you can use the liquid component of the hand mix glass ionomer. It's important that you're using a high viscosity glass ionomer because you're getting a high success rate. So we're cleaning the cavity with polyacrylic, and we're leaving it on there as per the manufacturer's instructions. In this case, it'd be 15 to 20 seconds. You'll pick up your damp cotton pellets, wash them out sufficiently, but not over drying, because that can affect the bonding of the glass ionomer. Now the next step is to prepare your glass ionomer. So in this case, we'll be using a high viscosity capsule and follow the manufacturer's instructions again. You should be using a high quality glass ionomer, as this can affect the bonding and it can affect the strength. Bear in mind that anytime you're using anything that's noisy or anything that can look a bit scary to children or phobic patients, like a gun, it can interfere with your cooperation. That's why hand-mixed glass ionomer is ideal for the atraumatic restorative technique. So when you get your glass ionomer, you pop it in the cavity and you're overfilling it. Now remember, it has to remain glossy, otherwise it's starting to set. So you have a little bit of time, but if you get moving, we're now using the press finger technique. You take a little bit of cocoa butter or the Vaseline onto your glove, and you press with the ball of your finger down and you roll backwards and forwards for about 10 seconds. And when you remove your finger, slide off. Because if you're lifting up your finger, then you're going to lift that filling out. And you'll get in there fairly quickly to remove any excess with your flat plastic or your carver. So as you can see, you've filled the cavity, but you've also sealed the fissures and the pits. So providing an atraumatic restorative treatment sealant, and that the important part of the ART is that you're actually covering the fissures and providing that preventative sealant to prevent decay for future. If you feel like it hasn't been filled in enough, mix some more and do the same thing again. The next step would be you can use Arctic paper to get the patient to bite together to check if there's any high spots, or you can just get them to bite down. At this point it should be fairly soft. You can use your excavator to remove any excess. And the final step is just to finish that sealant by placing a little bit of Vaseline over the top, or you can use manufacturer varnish like the Fuji varnish, and you advise them not to eat for about an hour so that can set sufficiently. And that is your final ART sealant restoration. So the take-home message, in line with minimal intervention dentistry, is not just to perform this technique wherever you want to, it's to recognise the caries first, and as always be patient-centred, treat each tooth independently and use this approach as necessary. So recognise the caries first, then remineralise using fluoride, oral hygiene instruction, diet advice, and then finally minimal intervention techniques to restore, such as what we have just described, the atraumatic restorative treatment. Thank you.